Uneven eyelid folds. How to fix this? I'm Asian, and the fold on my right eye is lower on my lid than my left eye. This means that when my eyes are open, the right eyelid folds over and is not visible anymore, while the left eye still has a large fold. Sometimes when I first wake up, the fold on my right eye is actually higher and matches the left, but throughout the day, the lower fold becomes more prominent again. How can this be fixed?
Thank you for your question. You submitted a question with a single photo showing you a close-up of your eyes. And you state in your question that you have a fold in your right upper lid that's lower than the left upper eyelid. And however, that you notice that there is relative fluctuation where there may be a crease at one point of the day and then it changes. And so essentially you're asking about symmetry and how to achieve that. In other words, trying to create an appearance that's more similar to what you have in your left eye, which is more stable and constant. Well, I can certainly assist you with understanding this, the way I approach patients who have similar issues as yours. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and Asian eyelid surgery is a significant part of my practice. So this type of scenario is actually fairly common. And so before explaining what my solution would typically be, I would first want to at least help you understand what's the basis for that solution. So when you learn about Asian eyelid surgery, you will come across basically two approaches. One is called an incisional approach, and the other is called a non-incisional approach. And regardless of the type of surgery, there is one basic principle that has to be adhered to in order to achieve what is called a double fold or an Asian eyelid crease. And that is to connect the skin to the muscle that lifts the eyelid, called the levator muscle. It's like the word elevator without the E. This is a muscle that has a connection for those who are born with a natural crease or eyelid that people who don't have that actually don't possess. And these little connections is what is responsible for creating the crease. So in surgery, we create those connections. So what helps me determine whether or not to do incisional surgery, where I'm actually typically removing skin, or to do a non-incisional surgery? Well, basically, is there the presence of excess skin? Is there a presence of excess fat? And usually, with someone with your anatomy, and this is in the absence of a physical exam, I typically would do this using a non-incisional approach. Now, what does that mean? Well, although the term is non-incisional, it basically means that you're not making an incision across the eyelid or removing extra skin, but rather what you're making is strategic little entrance points from the outside of the eyelid on the skin, and you are passing stitches in a very interesting way to engage the muscle, the levator muscle, and connect it and create a crease. So technically, even though it's called non-incisional, you are making little incisions, but you're not making a long one. Now, this procedure is typically more appropriate for people who are younger, people who have a scenario like yours where the anatomy is almost there, but it just needs a little reinforcement. So this procedure is typically done under local anesthesia, sometimes with a little bit of sedation, a little bit of relaxation medication to help you relax through the procedure. And basically it's fairly straightforward. And it's just a matter of placing these stitches, and so much of this procedure is in the planning. Do a lot of measuring and planning, and then placement of the right critical points on the eyelid to engage the muscle, and the creases that form are very nice, and they really hold up very well. There's always a question that's debated in this field about which approach is more long-lasting, but I think that as a general rule of thumb, if we look at the statistics from countries such as Korea, China, Japan, that non-incisional surgery is very, very popular and does have a really good track record. But again, it's really about the individual surgeon's perspective and approach. I perform the full range of Asian eyelid surgery, so for me, I'm very comfortable with this non-incisional technique, and I would recommend that most likely for someone like yourself. Again, this is in the absence of a physical exam. So with that being said, I recommend you meet with qualified, experienced cosmetic surgeons who perform or have a lot of experience doing Asian eyelid surgery and learn about your options. And once you're comfortable with the doctor and you like the results and you understand some of the other elements of how to determine the best type of surgery, then you will probably find someone you'll be comfortable with and move forward. Basically, the other factors that come into the determining of the style involve determining whether or not you want a parallel crease, a nasally tapered crease, but basically, if you want to try to match the other side, it's very often very straightforward, because once you put a little bit of pressure on the skin, it almost creates the crease that you want. It's similar to what people do when they put a little piece of tape to create the crease. And so I think that most likely just whatever critical points on the lid to get that crease to be formed to match the other side will essentially accomplish what you want. So I hope that was helpful. I wish you the best of luck, and thank you for your question.